This is One-on-One. Hi, I'm Steve Adubato. There's so many questions about the healthcare landscape in New Jersey and across the nation, and here to help us make sense of it is our good friend, Wardell Sanders, who is the president of the New Jersey Association of Health Plans. Good to see you, Ward.
Thank you for having me.
You know, it's not too much to say, it's not hyperbole to say the healthcare landscape is dramatically changing across the nation. Would you say that Obamacare, the ACA, the Affordable Care Act, is changing the hospital landscape to the point where you think there'll be more mergers, acquisitions, I mean, dramatically so in the next couple of years?
Yeah, so I think there's the forces at play here are, some of this fueled by the ACA. Some of this would be happening even absent the passage of the Affordable Care Act. I think that there's definitely pressure from the law that's probably pushing hospitals together to form chains a little bit more, probably pushing carriers, insurance companies together, and also, well, in a way, you have to be bigger to survive. It's becoming more complicated as a doctor to practice, as a hospital to work in this landscape, and as an insurer to work in this landscape. For example, hospitals today are now have cost pressures around readmissions, right? So there's an enormous effort. Readmission for somebody who's in the hospital and then leaves and then comes back within 30 days.
And the government says
there's penalties if you have readmission levels that are.
We're not going to give you as much as we would otherwise have given you.
Right.
So therefore.
So there's efforts to try to to address that problem, and in some ways a collaboration among stakeholders, of doctors, of payers, insurance companies, of specialists. The more that there's coordination and you can talk amongst each other better and coordinate care, there's a greater opportunity to improve the healthcare system. But that also means that folks are tied together more closely. You have to have administrative operations to be able to do that. So it's hard to be small in this landscape.
I've lost count of the number of healthcare-related programs we've done on One-on-One, on Capitol Report. I do with my colleague Raphael Pierromont, and you've done many times, on Caucus, New Jersey, and that you've also done on NJTV News with Mike Schneider, our great colleague. And let me put this in perspective. I keep asking myself, we are trying to educate folks, inform folks about healthcare. It is a never-ending battle, and I wonder to what extent we're actually helping people because it's so darn confusing.
Yeah.
Is it just me who sees it that way?
No.
Are we making a dent? I mean, what's up?
Well, first of all, I think you are. There's a lot.
I'm not saying that to pat us on the back. I don't really know.
Yeah. I think there's some good avenues. There's a website, NJ Spotlight, which I think has done a tremendous job.
NJ Spot. By the way, they are in fact a nonprofit. They do great work trying to break things down. Go ahead.
So they'll look at more maybe than the daily news, really in-depth stories that shed light on this. It's going to be complicated. When the healthcare website was being deployed, people talked about it as if we want to make it like
You mean healthcare.gov?
Healthcare.gov. We want to make it like a Zappos, or a Expedia.com. It's never going to be quite like that because the product you're selling is a lot more complicated.
Why did the federal government? I know you don't know the answer to this. I've always wondered, why did the feds promote it, the White House promote it like that, when in fact they knew it wasn't like buying an airline ticket? It wasn't. It was never going to be.
Yeah.
And therefore they raised expectations.
15 years ago, people had an expectation that was going to take a minute for a page to load. Right now, people expect websites to work, and so the disappointment level was really high when that rolled out, and deservedly so. It was a mess. I will say that over the intervening period, they talked about bringing in their sort of tech surge and their A-team. I thought.
All the things that should have been done in the beginning.
You wonder whether in the testing period they should have done. That it has improved dramatically on the consumer-facing side. So the consumer experience. If October 1st, I tried it, I couldn't get on.
Way back in 2013 when that happened,
right? But over the intervening period, by December, it really had, they had applied a lot of resources, done some testing, and improved it. So the consumer-facing side of that has definitely improved. Yeah, but still, it's a complicated thing. The confusion is still there, though, Ward.
The confusion is still there. The misinformation is still there. Why do you think that is?
It's inherently complicated.
Does it have to be? Is it? When you say inherently, you mean it is.
Yeah.
You don't mean people are trying to make it complicated. You're saying it is.
It is complicated.
It's like math. I hate
math.
to say it that way.
Yeah.
to me, math is complicated. Someone says, I'll simplify it for you. It's hard to simplify.
Right, and there's some people that are very good, but they're few and far between that can actually talk about it in simple ways that are also accurate. The Affordable Care Act tried to, through the hiring of navigators and other folks, to try to educate folks. And I don't know, I think they've made a dent, but it's inherently complicated. It's the insurance products that you buy are complicated. The care that you receive is complicated. So part of this probably has to be an education process in the schools to teach literacy around healthcare a little bit more, to teach literacy around financial issues and health insurance products. It's an essential part of keeping you healthy and keeping you out of bankruptcy too.
Talk to folks about your organization.
The New Jersey Association of Health Plans represents the major health plans and insurers in the state that serve both the Medicaid market, so we partner with the state to provide a more efficient and better quality experience for that Medicaid population, and also the commercial insurance companies that an employer or a labor union or the state or whomever to go out and buy insurance.
Do you lobby?
We do some lobbying, some educational work, some press work. It's a small office, but we're sort of chief cook and bottle washers all at the same time.
And for those who say the insurance industry is hard to make sense of because they don't see the industry as being transparent enough, easy to access and communicate with, you say?
Well, part of the challenge here is that as an insurance company, number one, you're always delivering you're the messenger of bad news often with your premium, right? So you're socializing risk across the population.
Socializing risk.
You're spreading risk, and like any insurance product, whether it's your home or your auto, you may not need care, but then you may need care that costs $100,000. So that's what insurance does. It sort of spreads risk around a population. The cost of that, though, can be, and healthcare costs are extremely high. So as a result, the insurance product is also very expensive. So you always have that difficult message as an insurer to deliver. But we try to address that through coordinating care better. So we have nurse hotlines, we have care managers and case managers working to try to lower costs and improve the quality of the experience that folks have. It's difficult, though.
The effort goes on. You have to keep doing this, right?
Yes.
That's why we have Wardell Sanders, who is the president of New Jersey Association of Health Plans, continue to try to help us make sense of all this. Well, I'm sure we'll see you on the other side on Capital Report or often on NJTV.
NJTV.
Thanks. Appreciate it, Ward.
Thanks
This is
for having me.
One-on-One. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Activists in cooperation with the American Medicine Chest Challenge, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, New Jersey Council of County Colleges, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.